whole how I got here
Mm.
is because I'm not gonna get blindsided, and, like, I'm gonna want these early detectors or these early and any early information I can get, I want. And you may see it as, why are we doing a $180 blood sample every year? And I see it as, there's a chance I'm gonna catch something early. That's why you've got me here.
Hi, guys, and welcome to the House Call Vet Cafe podcast. I'm Dr. Eve Harrison. I'm a full-time integrative concierge house call veterinarian in Los Angeles, and I help other vets to build their unique mobile practices on their terms. This podcast is for and by house call and mobile veterinarians, so it is meant to give our community a platform to connect, to share our stories, to lift each other up, and to support each other. Most of us work solo as lone wolves, right? So for me, it's been really powerful to be able to physically hear the voices of my colleagues from all over the world and to get a chance to feel that we truly are part of a community of very real other human beings who get it. While you may be alone in that little bubble of your own vehicle when you're on the road seeing patients, I welcome you to join our community by tuning into our own podcast when you're on your way to your next house call. Whether you're a super experienced house call vet with 30 years of experience, you're a brand new prospective house call vet just looking to get started, or you're house call curious, there will be something for you in this podcast. Each episode, you will hear interviews from other mobile veterinarians just like yourself who are doing unique and innovative things, vets who are sharing their stories, their struggles and challenges, and you can also look forward to hearing valuable information and perspectives from specialists and experts outside of our micro niche. And finally, if becoming a house call veterinarian is something that you've been thinking about exploring, or you're looking for some extra support getting your own mobile practice to feel more profitable and sustainable for you, check out the information in the show notes about my course and our above and beyond supportive private community for members only, plus our monthly group coaching sessions within the House Call Vet Academy. You can also check out my free public Facebook group, which is also called the House Call Vet Cafe, the same name as this podcast, and which is a warm and cozy community for mobile vets to support each other in professional and personal development, in creative entrepreneurship, and in friendship. So thank you guys for spending time with me today. Let's dive into the episode.
Okay, everyone. Today's episode is going to be ultra cool. It's a little bit impromptu recorded because today I have with us back again Dr. Surell Levine, who is the brains, the heart, the soul behind the Calm Cozy Cat Wrap, the beloved that I know every one of you listening is obsessed with, as you rightly should be. But anyway, so the premise of why we're having this conversation today is that we came together to record a lecture for the House Call and Mobile Vet Virtual Conference coming up in just a week or so. Well, it will be a week or so at the time that this comes out, but we're a little bit prior to that in the time of this recording. And we decided that Surell had this beautiful lecture that will be given during the conference, and we will just actually kind of riff back and forth on the subjects that we were going to talk about in this podcast instead, so that you guys get actually the precursor to the incredible lecture that Surell has prepared. And I can't wait for you guys to hear it, for you guys to be there and learn just like the gems of wisdom that she's got to share. And I think this conversation that we're about to have is going to be really, really interesting. We're going to be kind of investigating the subject of liquid gold, urinary sample and case management for house call vets. And I thought it was going to be really cool for us to chat because we each have very different house call practices. Surell is like ultra badass East Coast, like bring me anything, I will handle it in the home and I will save the day. Meanwhile, I have this like West Coast super chill holistic practice and I'm like, hey, you want a free catch? Fine, let's do a free catch. So, that kind of thing. So I thought it might be a really interesting conversation for us to sort of go back and forth and be like, oh, how do you handle this? How do you handle that? And just kind of demonstrate the actual diversity of, I consider myself a damn good doctor. And I know Surell is like as good as it gets. So I just am excited to have this conversation so that we can show that how many ways there are to do this. And there's no one way to, the expression, I'm not even going to say it, but since we're speaking of there's no one way to put a cat into a calm, cozy cat wrap. That's what we'll say.
That's true. I
right?
like well
I feel like
played.
punching
And
whenever
I
I
was
talk to
thinking
Surell.
about what you didn't say, and I was like, "Good, I'm glad she didn't say
Yeah,
it."
we don't say those words around here.
But I like what you came up with. There is
Yes.
one way. I do like this contrast because I don't think that my way makes it the only way to do medicine, but it's the way I think it's the lens through which I viewed the world when I was young and when I decided medicine was clearly the route for me as I was like working on this slide deck. It brought me back to how I became house call, of like why I do this and why I don't want to be part of the mainstream
Mm,
5 million animals waiting for you, and you're just spinning out with, like, who's in the back and who's waiting in the next room and who's on the phone, and you're just like you can focus on the one thing in front of you because you don't have a hospital behind you full of a million things.
right.
And I my mom died when I was very young. When I was 11, not super young, but I
Very
was
young,
she had cancer, and by all intents and purposes, everyone knew she was gonna die except for
yeah.
me, right? And that was the biggest obviously, I was super blindsided, and I think that that is totally played out in why I went into medicine, why
Mm,
I like the relationships I build at home, with clients, why no, I don't like them all, but why I feel this drive to be like, I'm not gonna get blindsided again. I'm not gonna have you get blindsided.
mm,
Like,
mm,
you may say all these things of why, "Oh, you're expensive, and why do you do yearly blood work and this and that?" And I'm like, "Well, if that's not your philosophy, it's not for me, right? We're not gonna work." Because the whole how I got here
mm,
is because I'm not gonna get blindsided. And, like, I'm gonna want these early detectors or these early and any early information I can get, I want. And you may see it as why are we doing a $180 blood sample every year? And I see it as there's a chance I'm going to catch something early. That's why you've got me here.
mm.
So
It's beautiful.
I don't know what it is, but it
No.
definitely is what drove me into this.
That's one of the most sincere motivations that I have heard in this work, you know? It's really driven by you're going to be okay, we're going to make you okay, and we're not going to be blindsided. Me, you, the animal. I mean,
Right. Well,
that's so meaningful.
it's
That's so much more
true.
heart than I've heard for a long time in why you do this, you know? It's
Well, I think it
so
is why,
moving.
it is why I do it. It is
Yeah.
why I don't know, I think a lot of people have I could have made this a bigger practice. I could have added on more vets, but it was never gonna there are not a lot of people that are gonna see it that way, right? And I think that for me, that I've always harped on this, the continuity of care, that you get the same vet every time because in this practice, you do, right? Not everybody practice does that happen.
Mhm.
And that's what I hated about when I worked in the
Yeah.
clinics. I hated it. I was just like, I don't want to sift through somebody else's notes. I want to know how this dog usually, is in front of me. Because I felt like details fell through the cracks, and I feel like because that's what I watched with my mom, she had so many different doctors for different little issues, and it felt like the big picture was missed. I don't want that for the ones I care about, you know?
Beautiful.
I think there's a lot to be said for a much calmer approach than maybe necessarily how I go about it, because I've got some sort of bee in my bonnet from the way I viewed things as a
No, and
kid.
it's so interesting that we all doctor in such unique ways, and it's all completely informed by our lived experience of what
Mhm.
cases we've seen, what family members we've watched go through what clients we've had, and what those clients have been concerned about. Like our
Right.
practices shape us completely, our lives, our lived experience. And I mean, that's exactly why they call it a science and an art in medicine. And it's really beautiful. Your patients are so incredibly lucky to have you because ain't nothing going past your
Well,
sensors, you know, and that's good. I
yeah.
mean, there's so many,
But that's not to say something's going past your sensors. I mean, I'm not trying to like, well, mine way is hardcore and yours is softcore. Like that, it's because
Yeah.
I think, and I'm not like a harsh person to be around
No.
when with my patients, so I think it's just sort of like this way we are able to what we're offering in a different way, and I think they both have a ton of value for different for the right person, right?
Yeah, and I really love it. I love the collaboration. I love what we have to offer each other. We've had so many conversations, kind of comparing and contrasting. I've learned a lot from you and hopefully vice
Likewise.
versa. But it's really beautiful that it's another kind of affirmation of, so many of us have worthiness wounds. Am I good enough? Am I right enough? Are the vet gods going to approve of how I do this, how I doctor? And the reality is we're our own people. We bring good. We bring good in the ways we know how. And
Right.
it's just so validating, I think, to hear other ways of doing things. And I hope it feels validating to our listeners as well. But I'm already loving this conversation. We haven't even
Right.
dove into the specific questions, and you'll see how we handle things differently in just a moment when we dive in. But I find this very nourishing, just to, that idea that there is no one right way. And truly, I think that piece can be really missing from so many of us who judge ourselves so harshly and have such incredibly high standards that oh, I don't do it that way, I must be wrong, and
Right.
it's simply not the case. It's different styles of doctoring, and that's beautiful that we can
It is.
celebrate
And
this diversity of worldviews, right?
right. I mean, I guess, and I've always felt like anyone can learn the facts. It's how you deliver them, how you have that rapport with the patient, with the owner, and how you build that trust and make it different from looking at Doctor Google or Doctor Chat or, it's
Dr.
uh,
Chat, now we have
well, we have that, right? I think we're demonstrating a different value than one of those.
yeah,
I think that
humanity
that's
is
it's like
so
you said,
important.
it's like the facts are there. Now we have them in our head and now you can get them on your computer easily. But like what are you doing with those? And what is the art behind it of how you want to, massage those ideas into what the plan is?
Beautiful. Oh, I love it. So, with that, I have a few questions that I would like to kind of guide a little bit more of our discussion here. I would like to know, what are your most common types of urinary issues that you see in your practice? You have, I believe, a little bit of a bigger practice than I have, so you might have a wider variety, but I'm
Mhm.
curious on house call basis, like, what are you seeing day in and day out?
I mean, think we all are seeing it. What owners characterize as a UTI, they think is
Yes.
often a UTI.
Yeah.
I think it's often something that needs a tincture of time and it maybe isn't anything. Because I get a quick like, oh my gosh, this happened. They peed in the house once, and I get how that's alarming. But I think if we give it a moment, it's probably going to play out to be nothing. But in terms of like stones or crystals or in dog world, I'm saying I don't see a ton more than UTIs, which may have a lot of difficulty with regards to anatomy and recessive,
Recessed vulvas, yeah.
recessed, yes, recessive, recessed vulvas.
I said the dirty
Um,
word.
I appreciate you saying it first. I was nervous. Oh,
So good.
but yeah, we have to evaluate that anatomy, right? Male or female. And so I think I have a lot of that. I think that plays into a lot of lot of UTIs I treat, a lot of immunocompromised animals that I think are playing into my UTIs. But otherwise, I don't see a ton of other, I mean, PUPD, sure, but I guess that I don't think of that as primary urinary tract,
Right.
right?
Right.
Though I do need to get my samples and I have to evaluate them in, a way that you're like, what am I going to do with this protein? How did I get this sample? What potential contaminants are there? But I don't see a ton of stones. And for cats, I see a lot of interstitial cystitis, it's not more than I expect because I expect it more than a UTI. But I've been surprised by the ones that actually do have UTIs where I'm like, huh, I really didn't see that coming. I thought it was definitely gonna be sterile cystitis. And because you're quick to pigeonhole, like, what you think you're gonna see before I've even gone to see the patient. I see it on my schedule, and I'm like, "Well, I know what that's gonna be based off your signalment." But that's as good as looking at Google, right? And I've got a physical exam to do, and I've got, diagnostics to do.
Mm-hmm. Mm-hmm.
How about you?
I would say it's a
What do you
similar,
see?
similar. Yeah, it's a lot of UTIs. It's a lot of, feline lower urinary tract disorder, fluid or interstitial cystitis, if you want to call it
Whatever
that.
they're calling it
I mean,
these
they're
days.
related, I suppose, not exactly
Yeah.
the same, but I guess for me, it's Well, I actually just learned. Now I'm mad at myself because I didn't even remember to like look up what this thing is called. But I have a patient that was having a little bit of like pollakiuria, but urinalysis completely normal and repeatedly. And we have an ultrasonographer that I hire to come. It's actually an internal medicine specialist who's wonderful. And just on an as needed basis, I bring that person in to do a full ultrasound or just even like bladder stuff if I can't get the
At
bladder,
the
you know?
client's house?
Yeah, it's wonderful. It's
Wow.
wonderful. Yeah. So that person's an internist, and they were like, there is actually a condition that is like the sort of pollakiuria or just kind of urinary symptoms that are just literally secondary to another condition. And this cat has IBD. And he was like, it may just literally be a component of the IBD that's expressing in a urinary way. And there's a name for it. And I was like, what in the fuckity
Well, I mean,
fuckersons?
that makes sense to me, right? Like, I often see
It does.
owners, right, that, the stress organ in the dog is the GI tract and the cat is the bladder, and if this cat's having has IBD, like, it's not a far reach in my brain to say, "Yeah, okay, maybe your bladder's also acting up from that," because the inflammation and the stress around it is having it's the same transmission, the same,
Yeah.
chemicals that are causing those.
Yeah. And it
Um,
is it's a physiological stress, and stress is what causes,
right.
you know. But it was very interesting because the urinalysis results were spotless. Like there was nothing that you would see, like no
Mhm.
inflammatory cells,
Yeah,
nothing. And so
right.
it was just like behavioral and stress related. I don't know, but it was very interesting to me. And then otherwise, pretty much the same. I don't have a whole lot of stones in my practice.
Right.
And yeah, I mean, I try to get all my patients to drink a lot of water anyway. Like
Yeah,
I add water to everyone's food, so
I
preemptive.
I agree. I like to flavor the water a little, thing anything to increase it. I do see more so recently, I think, than I once did, urethral sphincter relax. What's the hypotonus or whatever, what the
Yeah.
phrase is for it.
Okay.
And I think I find that as I'm working up these UTIs where I'm like, you know what, didn't used to always be part of my questioning, but as I'm starting to see more recurrent ones, I'm like, hold on. I need you to really pay strict attention. Is there even a drop? What is pooling potentially there overnight that we are not necessarily seeing because it's not a big amount of urine on on the blanket when they get up, but like you need to now really take a moment to pay specific attention to it as I've seen more recurring ones.
That's true. I do have some older animals that who have a little bit of urinary incontinence as well, so that does come up
Yeah.
periodically also in my practice.
Hey everyone, this is Dr. Eve Harrison here. For my fellow house call veterinarians who feel the daily weight of solo practice, and for those dreaming of mobile practice but unsure where to begin, this one's for you. I'm super excited to announce that registration is now open for our 5th annual House Call and Mobile Vet Virtual Conference, February 7th and 8th, 2026. So mark your calendars, because whether you're struggling with pricing, boundaries, work-life balance in your current mobile practice, or you're looking for a clear roadmap to start your house call journey, we've got you covered. This isn't just another CE event. It's certainly not another corporate CE event. You'll leave with actionable strategies to increase your income, protect your time, and build a practice that truly works for you. Here's what 2 of our attendees had to say. Thank you, Eve, for an amazing conference. I love how you spoke from your heart and how you and the speakers were so encouraging. I've been thinking for a while about going mobile solo, and you made me feel empowered, knowledgeable, and not alone in designing the work lifestyle I want. Thank you from the bottom of my heart. That was Dr. S, and she is now an active house call vet, which makes me so happy. And then we have another testimonial from Dr. K. This conference is so fab. The small group breakout sessions are perfect for introverts, learning practical and personal skills I can put into practice immediately. Worth every penny, and so nice to soak in the wonderful collegial vibe of my people, my community. So if you're feeling excited, inspired, and ready to sign up, don't wait too long. Head to the link in the show notes or www.dreveharrison.com to secure your spot and join a community of veterinarians who understand exactly what you're going through, because we're living it too. I'm Dr. Eve Harrison, and I can't wait to show you just how amazing mobile practice can be with the right support and community behind you, and to celebrate with those of you who already know exactly how life-giving this path can be. Now back to our show.
So I think one of like the most exciting things to talk about, one of the most frequently asked questions that I get from people who are either new house call vets or considering doing house call vet, how do you collect the urine sample? How am I going to get the urine sample solo? How am I going to, what if I don't have an ultrasound? What if
Mhm.
there's a million people really kind of panic about that and they're like, I can't be a house call vet because the urine.
Mhm.
I'm like, oh, just you wait. There's so many ways.
Right. There's so many other reasons.
So I would love, you have some great ways,
Yeah.
and then I have some other ways that I
Mhm.
tend more towards. I'd love to hear your urine collection stuff. Being
I
a
will
vet,
get
you know.
yeah. So, I mean, if we're talking dogs first, I mean, I use ultrasound a lot. I feel like it's part of my standard of my physical exam. I wanna see, is there a ton of junk floating around in that bladder? Where is that bladder? Is it very pelvic? Is it more abdominal? What, I'm not a radiologist by any means. In fact, I'd say I'm pretty damn bad at it, but I'm very good at saying that doesn't look right. And that's all I need to know, right? Like, I'm not looking to make a diagnosis. I'm looking to say there's something here that's not quite right. And I think we need to get it further evaluated by someone who is a radiologist. And so I like to take a little, I call it, I drive around is what I always say. I'm just going to take a little drive around and, check out what I see. And I'll let, if I'm looking for red flags. And so I do that a lot with dogs, even if I'm not necessarily trying to get a cysto, but I just want to take a peek and say, nothing obvious. Okay. And I do like to start with a free catch in all honesty with dogs. Depending on the behavior of the dog, if it feels like this is an easy one, or if I feel like I look at it and I'm like, "But that is a really recessed vulva," now that we've said the word. Uh,
Broke the seal.
I am like, "You know what? Chances are I might wanna culture this," and so I do wanna start with a cysto. And I'm also reading my owner and how much they're gonna be uncomfortable with this, and how much they're like, "Well, if I see this one's on the books, if I see a urinary issue for a first time urinary issue, first time for this patient, I might say to the owner, you know what? Yeah, I'm going to come check it out. Catch that first morning urine the morning before I come. So I'll send an email out the night before of just like get that for me so we don't have to so we at least have a sample, especially if your bladder's empty, right? Like, and then I'm like definitely can't get a cysto and we have no sample to leave with. So I like to look ahead very much so, and I feel like owners are very receptive to that. I use my vaccine trays, like the old trays when I'm done with my vaccines. That's what I keep. I keep a stack of them in my car, and that's how we catch them urine.
Oh my God.
And my we have it so I work with another doctor, we do everything together, right? So I'm not totally solo, and so we have our technique of Shelly walks, I walk behind with, the tray, no one distracts us, we don't talk because if we chat at all, we will not pay attention well enough, and pretty much 100%, like, getting my sample because we have our way now, we've developed it over too many years,
That's really smart,
like,
actually. Like, it's a
look
wide surface area, so you can't miss. That's
yes.
hilarious.
That exactly. I'm serious, and then, then we suck up our syringe, and then I recycle my, tray, and it works well, and so I never send an owner out. If I'm at the house, I don't send the owner out to do it, and I'll tell you for a couple reasons. One is I think sometimes they miss, and then I'm like, "Shoot, I'm leaving here without a sample," and 2, I wanna see how they urinate. I wanna see their posture, I wanna see that stream, I wanna see that process, um and if I'm being picky, I will try to get a midstream sample, but sometimes, but I'd say most times that is what happens because I don't wanna be swoop in waiting
Right.
that makes them nervous, and so I
Right.
really am I always wait for them to start urinating before I can get that under anyways.
Totally.
And then, yeah, I cysto a lot. Dogs at home, like, we get them turned over on their back, and my other doctor is the trough with her legs, her thighs, and the dog's head is up on her belly, and the owner can be rubbing the dog's head, and I'm driving around with the ultrasound. Or sometimes I have the owner having to hold those back legs in a safe position for me so that no one moves. And cat-wise, I almost never get a free catch or a litter box sample, and I use the Cozy a lot for that. I drive around with ultrasound, I like to use a short needle, I like to know exactly where I'm going and be like, "There's 0 chance I'm gonna get the aorta or go through the other side." I like to feel very safe in my decisions there. I find what's frustrating not so much as when their bladder's empty, but when it's a patient that needed a sedative. And now I'm like, shoot, I didn't get my sample. Now I'm going to need you to give gabapentin again before I come to get this sample. And those are the ones I'm like, you know what? Let's try some nose orb. I'm not against nose orb. I mean, especially if I think it's not going to need a culture, but I have cultured some free catches too. I mean, on patients, and I'm like, this is just not going to go well. So let's just take what we can get. And, I have them baby wipe the area first, and I sort of
Great.
say, try to get their midstream sample. That was a lot. I said a lot.
No,
How about
that's
you?
great. That's great. Yeah, no, I love it. And then in just a moment, I want to hear your process of getting the cysto, because that's what
Yeah.
intimidates people, right? I
Sure.
know you have cool methods and stuff, and you talked about the positioning and things like that, but I want to go deeper into that. For
Sure.
me, I am a free catch girl whenever I can. For dogs, the default is free catch for every dog. I will either go out and do it myself, like the owner will walk, and I midstream, just like I use the sterile cups for my decks.
Yeah.
And like the thing with that is you open the top, make sure you don't touch the inner lid so as not to contaminate it. And then most of my UAs go out. And I think it's kind of worth mentioning that as a house call vet and as a person who is using a lot of free catches, I've adjusted my interpretation of the clin path.
Yeah.
I also adjust my interpretation of the clin path of lab work, blood work, based on things that I'm doing and circumstances in the home as well, which is
Mhm.
a whole other conversation. But I'm very used to seeing a little bit of bacteria in the urine from a free catch. It doesn't scare me. For years, every time I saw bacteria in the urine, I would call IDEX or I would talk to my internist friends. Do you think this is a UTI? Do you think this is a UTI? Do you think this is a UTI? So I really cultivated a sense, and I think that's what people are afraid of. Well, if you have a free catch, how can you tell if it's a UTI or not? And sometimes I'm just like, nah, it's not a UTI. And other times I'm like, I don't know. We really have to cysto at this point, right? But in
Right.
general, kind of my rules of thumb are if it's just scant bacteria, the numbers of bacteria, and everything else is normal, I'm like, okay, it was probably contamination. We're asymptomatic. It's contamination. Okay,
I
great.
agree.
Perfect. Now, if there's a symptomatic animal and there's a little bit of bacteria, I'm on the fence. Like, do I get a cysto or do I interpret this with a little bit more conservative sense of like, I mean, it's still kind of normal to have a little bit of bacteria on a free catch on the
Mhm.
skin, especially if you haven't like alcoholed their prepuce or
Mhm.
other areas, right? But what really catches my attention is like the isocineria, the high white blood cells, high red blood cells. Now, red blood cells are normal on a cysto, but in a free catch, that means a lot more to me in a free catch, right?
Yep.
So I interpret different, like very differently, and I'm used to doing this because the majority of my dog UAs are this way, right? And if everything, even, well, crystals, I don't know. Yeah, I mean, if the pH is really off, I
Right.
also am like, yeah, dealing with you. And I've also done culture and sensitivity based on the free catch. If I was like, this is obviously a UTI, and I've
Yeah.
treated successfully based on that as well. And what's the other thing? Crystals. So there's another aspect of just kind of artifact that you might expect to see in the house call environment that I thought was worth mentioning, that if you were like me and you go home and then you refrigerate, I don't carry a refrigerator with me. I'm not that high.
Didn't carry a cooler?
I mean, on an as needed basis. So if I have a medication that I'm giving, I bring it, but I don't restock the cooler with ice every day. And if I go to the home and there's a UTI that I didn't expect, I catch the
Right.
sample and then when I get home, I
Yeah.
refrigerate it, right?
Okay.
So what that can do is we know that the delay can increase crystals. So I interpret in light of a pH maybe a little bit outside the range. Okay, it had a little bit of a delay to get home. If I know I'm going there to collect samples, I bring the cooler, but I don't always. It's not, if I need to. The cooler's always there, but the ice pack isn't unless I've planned it.
Yeah.
The crystals, and also, I mean, there's also refrigeration itself can increase crystals too. So it's sort of like, you
Right.
interpret crystals in light of the circumstances. So those are just some things that I wanted to kind of put out there for people who are afraid of free catch, because I'm not afraid of it. I just know how to handle it now. I know how to interpret it better. And there's also nothing wrong with calling IDEX for every freaking
I
sample,
agree. I
right?
agree. I've called them a ton. So I get some
All the
great ones,
time.
some great consultants,
Yeah.
some I'm like, It wasn't very helpful.
Yeah.
Um, but I think I've been burned a few times on cultures not on cultures, sorry, on cystos that I was like, "You know what? I'm gonna see what the urinalysis shows before ordering the culture." And these have been animals that I have even sent for massive workup referrals and embarrassed to find that even though they weren't isostonuric, they were, mid-range, weren't super concentrated, say 10,
Oh,
30, okay, but it
that
was
too. That
random
too.
time of day, okay, so it's random. I haven't cultured them. I've gotten these very boring urinalyses, even though these dogs are symptomatic seeming. And then I will ultimately culture them and they grow something and they have been resistant. We've worked up these, I've done massive workups where I'm like, I cannot believe I never cultured it because I was basing it off of my urinalysis being quiet. And those really, I think that I'm thinking of one particular patient that I got burned with. I didn't get burned. I mean, everyone was fine
Yeah.
ultimately. It was
Right,
not a big deal, but it felt bad to me that I was like, in effort to save this client money, I decided not to culture this because I normally would have just said, I'm ordering a UA and culture. I'm not even going to look at the UA first, knowing that I had cystoed it, knowing that this dog had UTI signs and it had had multiple in the course of a couple years. But in effort to save money, I always find that not always, but I often get burned. And like,
yeah.
that's just an annoying reality. And I
No,
don't
it's
like,
like this no, that no good deed goes unpunished. And it's like,
right,
to clarify for anyone who's listening, save the client money, right? Not
right.
ourselves, right? It's to
No.
save the client money. And then that's where you're like,
And in
right?
fact,
I
then
was trying
I'm
to do the right thing for everybody. And I thought this was the highest likelihood of this being actually just a needless test we don't need to run, you know?
right. And because it's such an expensive one. When
It's very expensive.
have I used to have an incubator at my house. I still have it. It's just unplugged if anyone needs one. But I was getting my own plates and I was doing the in-house cultures just to say if they're negative, we're done. If they're positive, I'm sending it out. But like
Great.
to not waste so much money of the client's money because I barely mark these tests up, like because I
Right.
feel
Same.
very anxious about them, right?
Same.
And so I know it's like the best medicine, but it's so expensive. And if it's negative, you're like, what the hell was the point? Even though it's important information. And so I ultimately was like, well, I'm going to get culture plates and I'm going to do, and I got an incubator and I did it for like a year before I was like, this is just so much extra work that I'm not sure is changing much in the grand scheme of how much money ultimately gets spent. Maybe a few clients felt that it was less because I was charging like $40 for this in-house culture. And if we had to send it out, oh, it just felt so cumbersome in a way that it wasn't worth it.
Mm-hmm. But that's
And
so,
it
I
was
mean,
a
that's very
delay
ingenious
in,
though. Like, I really like that. At a certain volume, that would be, at a certain scale, that absolutely would be the
right.
smartest thing to do. And maybe it was, maybe, I don't know, maybe it saved a few people money and they were appreciative. But
Did.
I mean, it sucks being like, I'm going home to my plate of bacterial cultures growing in my house. Ew. What do we need
It
this for?
was, yeah,
Like,
it
ew.
wasn't great, but it felt like, again, this is a really expensive test. I use
It is.
IDEX.
Yeah.
It's there's no way around that test being expensive, and I was trying.
Oh,
Mm,
and all
but
all
again,
for the
it's
good of the.
delayed things, I'm like, "Oh, well, this grew, and I wish it are now I gotta send it to the lab, and it's gonna grow in another 4 days, and we'll get the results." I'm like, "This it was a nice idea, but in reality, it's only good if it's negative." When,
Yeah.
like,
Yeah.
otherwise, you're super delayed, and you're like,
Right,
"Well,
right.
you started something, but now I don't know."
Yeah, I really like your outside the box thinking. I don't know any other house call vets that do that, or at least give it a try, right?
Mhm.
I mean, that's really cool. Like, I love that. I'm very similar in like that sort of balancing the most thorough test with the owner's pocketbook. And you're like, you don't want to be like spending all their money for tests that don't have to be done. And I'm likewise, for me, no, it's cultures. It's the same. I'm not sure I even mark it up at all. I have to check my prices, but I'm like, I can't let the price of this hold people back from doing this test that has to be done right now. We
I
can't
agree.
let that happen. And so I'm just like, I'm going to eat it. It's just going to be my
Right.
business, a cost of doing business as a veterinarian who gives a fuck,
As
you
what
know?
makes yeah, as what's okay for me mentally. Yes, I
That's
agree.
right.
And
So I can
sometimes I'm
sleep
like,
at night. Yeah.
just like the
Yeah.
UPCs. I'm like, "Why is this add-on UPC so much money? I can't mark it up." Just like, but that doesn't make it right. I mean, that's because we're a little bit crazy, right? You're like, and you know what? The owners don't even know to be appreciative. So it's not even like, it's just a your own coping with yourself
Yeah.
mechanism,
Yeah.
which chances are a client who is going to complain about money is going to complain no matter what. And they have no idea that you were like, actually, I made $0 off of this. I paid employees, like
Yeah.
we're at a
Yeah.
loss.
No, it's
And
for
you're
here. It's for
still
right here.
complaining, but there's something, yes. And that's part of what I love about having my own practice, right? Is like I get to make decisions that are terrible business decisions, right? But but feel right.
Yeah.
But that's conflicting because I hate when people are like, oh, don't you care about animals? I can't believe you're going to charge this and this. And you're like, yeah, I care about animals. I care about my family. I care about my balance of can I afford something that's going to make me not lose my mind at my job because I want, I don't know, another latte today because I'm crossing town a million times and this schedule looks like a nightmare and I just need another Starbucks run. Okay. They're expensive.
It's
And so
such a
someone's got to
balance.
pay for it.
It's such
Right.
a that's exactly, you hit it on the head. It's like sometimes we make a decision that sacrifices the business. Sometimes we always put the patient first, but sometimes to the extent that it actually harms, quote unquote harms, but then our soul, right? What risk for moral injury we have. And we could talk about this all fucking
All
day.
day.
All day, you and I, right? Almost anyone who's an entrepreneur and loves animals and wants to just for their heart do the right thing, which is almost all of us, right? Let's record another episode diving deeper into that. But in the meantime,
I just have to say, look, I know we're on urinary tract, but that just struck just a chord for me today because I was actually seeing someone today who I was supposed to put their dog down recently. And then they decided last minute it was not time. And I was like, of course, like that happens. Zero problems with that, right? And they happened to be friends with my daughter. So I was dropping my daughter off at their house to play with their daughter. And the husband says to me today, oh, stay away from Bear because the last time I was supposed to see Bear, I was supposed to be euthanizing him. Right. And I was like, is that a joke? Like,
mm,
would you say that to a hospice person,
yeah,
doctor? Would you like,
yeah,
this is not a joke, my job. Like, I'm not coming for your dog. I'm
yeah.
like here to relieve the misery.
It's
You
so
know,
hurtful.
and
Yeah,
it is such a weird the way we have to protect ourselves is unique from any other field that exists, and people's weird response to be feeling like it's totally fine to say, "Oh, here comes the Grim Reaper," or something that you're like, "Ah, that is not what I'm doing."
that's right. That's
I
right.
can't believe I have to explain how that is so incredibly hurtful to like this soul that you've put out there. You're like, I'm coming into homes. I am fighting for you and your animal, sometimes more than you are,
All
right?
the
And
time
that's its
more
own
than you.
problem, right? Again, you and I could talk forever. And you're like, how could you say something like that to me?
Right, right. So hurtful. I mean,
Mhm.
it's such an inherent and unique set of emotional factors that we have to hold, the way we're guilt tripped, the way with inadvertently sometimes people have no idea the psychiatric state of mind you have to be in to provide services like this and to advocate for an animal that cannot speak, and people doctor googling the wrong thing or doing the wrong thing, etc. It's like we could talk to no end about the psychological state of mind you have to be in to be a veterinarian at all, right? As
Right.
a,
And
as
how that
a
changes day to day. Some days you're like, I'm ready to do this. And some days you're like, I am defeated, right? I don't know. I
the
need to
extremes
go
are very
snuggle a
extreme.
dog,
The
my
extremes are
dog.
very, it's like every moment is life and death, right? But
Right.
anyway, on that note, just something a little bit lighter, I would love to hear a little bit more
Get
about, okay,
later.
now we're getting back to life and death because now we're talking about cystos. But
Mhm.
basically, okay, so I also do cystos on cats and I do it by feel because I was first a vet tech that was prepping cats and dogs for, cats for spays and neuters. So
Oh
you
my
would
goodness.
empty the bladder and you would do that
Sure.
by feel. So I have a great feel. Sometimes it's a fat cat and I can't get my tiny little hands around it. So then I call in my vet tech to do the cysto by feel. Now, for you, I would love to know, how do you use the Calm Cozy cat wrap for
Mhm.
cystos? What is your technique? What are you thinking in your mind?
Yeah.
Like, what logistically, like everything about how you do this? I would
Okay.
love to hear your
Totally.
breakdown.
First of all, I'm the same way, okay? I like to feel that bladder. I want it in my hands. Yes, I look with ultrasound, but I don't always go ultrasound guided with cats. In fact, I would say rarely. Sometimes I peek, I drive around, but then I've got this in my hand and I'm gonna go do it. I would say rarely, 50%, less than 50% of the time,
You're
no.
on the side, right? Not
Um,
in lateral
in
recompense.
lateral when
Yeah.
I do my cystos, yeah, for any almost even if they're in their cozy, I'm usually lateral. But in the cozy, I mean, I think you have to have not huge hands. And I'll tell you what I am thinking mostly, because chances are I've got this cozied cat. My other doctor or the owner or someone's just like scratching the cat's head because that's the beauty of the cozy, right? You can focus on the cat's experience. No one actually has to hold this cat in a safe position. I think the trickiest part about being in the cozy is you can't pull those back legs back, right? They're in the cozy.
Right.
Um, I also find that a lot of cats hate having their back legs pulled back, so
They
it's
do.
fine. There's less fighting against that. And what I'm doing, and it takes a few times at least, is I'm getting into that zipper that's on midline, on their on ventral abdomen, and I'm trying to get my left hand in there to stabilize this bladder. And then the number one thing I'm trying to do is not poke myself because there's not a lot of room. Right,
Yeah.
and so I've stabilized, and I also have to get in through the zipper and get my needle into the bladder, and I have gotten very good at it. I also have gotten into weird positions where because I'm on the ground usually, and I always want someone sort of stabilizing the spine, right? So the cat doesn't move away as I'm starting to push my needle in. And so I've gotten into these positions where, I've got my leg here but on the cat's spine,
You're fine.
and I'm sort of like, it's totally like that, right? This job keeps you limber. And I
Yes.
think it's like it's good for us in, in that
Better
way.
for yoga.
But I definitely will do it just, I've got it there and I'm trying not to because there's hair and it's all dark hole. And I feel like it's like how my soft tissue surgical professor in vet school used to say, like, dark, deep, lot of blood. That's the definition of soft tissue surgery. But it's not a lot of blood here in cystos. Hopefully, but that underscores why I like to have my hand on that bladder because I definitely want to know I'm not near the aorta. And I like
Right.
to go with I go in with very small, the 25 gauge half-inch needles, and I can get in through that ventral zipper. And again, I feel like cats actually do really well because if they don't like having their legs stretched back. Occasionally I find that complicated, right? Occasionally I'm like, oh, I can't actually, my hand's not big enough. And then I will either do it ultrasound guided. And I like to actually prop the cats up a little bit against my chest so they're not completely on their dorsal recumbency. I like them a little bit up and I find that they're much more comfortable that way. And once they're in the cozy, you can manipulate them into different positions and they're kind of like, oh, they're loafed. And I think it's a very safe experience to get these cystos with them.
Hmm.
Um,
And now I think I just want to also back up because we've been talking about the aorta and all
Mhm.
this scary, scary stuff. For anyone who's listening who is either
Mhm.
not a veterinarian, who has a
Right.
cat who's had a cysto, I want to say that it's like incredibly, incredibly rare to have anything to do with the
Incredibly.
aorta. Because my clients sometimes listen to this, and I mean,
Okay.
one of the main reasons it's
No, I
the
will.
one
I've never had it happen. Okay.
it
Like,
hasn't
you
happened.
look with
It's like
ultrasound,
it's
you
like
see it
point
there.
oh, yeah, that's right. It's 0.0000001%, and I've heard of it happening to someone I know once in vet school. So this is like you
Right.
really, really have to be off
Sure.
your game for this to be happening.
And in lateral, you can't do it.
That's right. That's right. And for us vets that are me and Surell that freak the fuck out about any possible side effect, we're so beyond careful that it's just not
It-
even a thing, right?
I'm
So
always looking at worst case scenario.
yes,
How
yes,
my brain works
it's our
is I
job.
want to know that's worst case. Well, I'm not getting there, and so yes, no one worries about the aorta. Okay,
Right.
no one does. But
Except
it's
you.
like
No,
it's in
but
my
I'm just
head.
kidding.
I look with ultrasound, I see it there. It's just like I'm always like these are part of my landmarks, right?
Landmarks, that's right. Yep.
And how long a needle do I want? How big is this abdomen? And those are just that's always just a thought of like
Yeah.
Where are
I
the
mean, so if
where are
somebody's like
those?
a new grad and they're like, "Oh God, how dangerous really
Right.
is this?" or
No.
something like
Yeah.
that. It is interesting. And also on that note, being a holistic vet and having a practice where less is more as like the holy grail, of
Mhm.
holistic practice in many ways.
Right.
I have a lot of clients who really freak out. They're like, "Do we have to put a needle in his bladder? Do we have to do that?" And that's one reason that I've been trained by my client base to start out with free catch. Even I have one cat patient that my client gets a urinary free catch. I'm so proud of her. I'm like, "How the hell did you do that?" And like, we'll also try the litter, like you said, or the nose orb, something like that. But I really have clients that are very scared of that.
Yeah.
So that's in my practice. That's one reason that I practice the way I do. I've been trained by my own clients, right? So just looping back to that, I thought that was
Yeah.
worth saying. But yeah, I love this sort of specific way that you position and your landmarks and, your hands. And I agree that with the Comcozy, it's because their legs aren't stretched. You have a more
Yeah.
narrow window, not more narrow to hit the bladder, but more narrow to hit the bladder and not your hand.
And not your hand. And not your hand. That's exactly right. And that's where
Yeah.
it just takes like getting to know where your hands are and feeling like it just takes practice. I'm curious to know how you have cats get their samples at home.
I have one client that is just like, she's just great. She's just very resourceful and like willing to try anything. And I don't know how she does it. I really don't. She's just waits. I think she reads the cat's body language. She knows a pee is coming. And like maybe the cat squats down, not so low that she can't get under. But she's like on it. And I'm like, I don't know what you're doing, but bravo.
Right.
Standing O. That's absolutely amazing. So I've read out some of those as well, and they're relatively clean. Those don't have much bacteria in them either, and they're also midstream, right? Cats are a little bit easier, I think, than dogs are more bacterial, so to
I
speak.
think,
But
I mean, their feet are filthy. It's
yeah,
like
they go outside, they sit on the ground, and yeah.
yeah.
But yeah, so she does that. And then I also sometimes, like, if I don't really suspect something's going on, but we're getting the urinalysis because the owner is worried, sometimes we're treating the owner more than we're treating the
Right.
animal. I will have them do, oh, what is that cat litter that changes color? Pretty litter?
Oh yeah.
I'll give people a task. Here's this pretty litter. You tell me if anything's different, and we'll look at the results together every day. So we don't actually have to collect a sample, but it's like, yeah, the owner is feeling concerned, and I'm like, this is completely normal. I'll
Right.
give them that so we don't have to do something to the animal rather than for the animal. You know what I
Right.
mean?
Yep. Yep.
That's one of my mantras that I say to nervous owners, by the way. Let's make sure we're doing things for the animal rather than to the animal just because we're nervous. Let's make sure that
Mhm.
this is really warranted, right? But at the same time, we can get burned by not doing it right. So
Course,
they're
so
going
that's
back
why I'm
full
always
circle.
nervous about that, right?
Uh, yeah,
I've
then
had
there's
some
also
owners flip the pee pad in the litter box. That
oh
works for
yeah.
some cats, but
That's great. Yeah, that's
uh,
great. Yeah, you flip the litter so you
mhm.
can collect the sample. And
Yeah,
there's all sorts of companies that have like litter collections, like the Nose Orb is one of them.
right.
And you had mentioned another one, which you'll go into in your lecture. I know that's coming. So that's
Yeah.
going to be really cool. Oh my God, we're covering so much right now, but there's so much more in your lecture that I was like, oh, this is going to be a great conversation. Oh my God. Yay.
Do. I think I could go on about a million things. The cat, I think that I personally don't think I get enough urinalysis done. I think like in a species where we're really worried about kidney disease is coming, and that's going to be our first sign of it. I feel like in our population of house call people, we're already decreasing a lot of the stressors as much as we can. And so at baseline, this is going to be a better experience. And so to answer to the point where you're like, owners are like, do you really have to do this? I'm sort of like, look, I don't have to, and we can stop. But I do feel like we're here to make sure that we catch things early and that we have data to look at, especially so that like next year when something's a little off, we know what it was this year and like how off is it and how quickly is this progressing. And I think I have gotten a little bit of a reputation where I am of like, I'm the standard of care, is what people have said to me. I'm gold standard for how to do this. Now, I don't know who came up with that phrase. And yeah, it's nice to hear, but also I think it's a lot because I don't really give, to be honest, a ton of options. I'm like, this, unless you're going to fight me on it, and then we'll talk about options. Or I'm talking for preventative stuff. Like,
Yeah,
I
yeah,
always present, all
yeah.
the various ways we can deal with an illness. But preventative stuff, unless you're gonna like really dig into me on it, I'm always going to get a mini panel done. I'm always gonna get ChemCBC with my 40X. I often want to get urine. Like, I want that information because again, I'm comparing this year to year. Yeah, your hematocrit was 45 and that's fine. And now your hematocrit's 39 and that's still fine. But had I not had this 45 and now I'm looking at this 39, I'm like, something's not right. And either we're rechecking it or, we're going to work something up, even though you're not anemic yet, you're like, and
Yeah,
so
so
that's where I think this gold standard idea, for at least that's how I interpret it, is like, I'm getting that data. Now, yeah, it costs money and that's annoying. But if the goal is to create a lifetime of as best optimal health as I can provide, that's the best way I can do it. I can only do so much with my physical exam. I can only do so much with looking around my environment and saying, is this, by the way, does anyone know it smells like pee in here? Like, do you guys know that? Because I smell it. Like, your
yeah,
dog's peeing somewhere, your cat's peeing somewhere, and you don't know it.
right,
Um,
right. Yeah,
so
brava. Yeah, cheers to the gold standard. Cheers to the liquid gold standard on the theme of this podcast
yeah,
episode. But I mean, it's beautiful. Like tracking trends is so important, and that's one of the ways that I kind of communicate value to people who are like a little concerned about running certain tests. I'm not a person who does tests for no reason, but if we're looking at a trend, the only way to know is to have a normal baseline and watch what happens next. That's all we have right now. Maybe in the future, we'll have those Star
right,
Trek scanners that will just be like, this is how it was now, and this is how it was before, etc. It's actually so holistic, really, to be looking at trends rather than just reference ranges, right? That's so
right.
holistic and so progressive in a veterinary way. That's good thinking. That's nuanced medicine. That's
Right.
catching
You're not looking for what got flagged on that lab work. You have to
right.
be looking at, yes, what has changed within the normal parameters and know that these normal parameters are rough. They're not your normal parameters. They're most people's normal parameters,
That's
right?
that's right.
And we have to define. I have some patients that sit at hematocrit of, 60, and you're like, well, is that a problem? But you're like, you've been sitting there for years, and in the beginning I rechecked it a couple times. I was like, is this going up or do we need to deal with something here?
Mm-hmm.
But you're like, that's your normal now. And it's never
Now
been a
go.
problem. I think about that too. It's just like we check their weights. We check just like you get your blood pressure taken, whatever. Like we're gathering data so that we can compare it over the long term.
That's great. Yeah, I love it so much. There's so much we could say on the subject, but I'm going to leave the rest of it for your beautiful lecture during the House Call and Mobile Vet Conference. I wanted to highlight your use of the word tincture of time because it occurred to me as you were saying that that is literally my favorite medicine as a veterinarian. Tincture of time. So
I
I
use
know you
that
said
phrase
that like an hour ago.
constantly, but I use it constantly, honestly.
And that's like the most holistic. It's so fantasy world and mystical, which is like my aesthetic, really. Like I have a staff from a fantasy world mage right now, but tincture of time, just like really it's on brand, I think, with anyone who's doing holistic medicine. And people like to hear that. And it's very effective. It's not placebo, it's the body knows what to do. The body is
Right.
a healing machine, right? And we're here just to support it.
But also
Anyway.
to your point of holistic, it's like I might be very scientific in my approach and you feel more holistic. I'm not, I think at baseline, any of us who have gone into house call, most of us have this holistic idea. Whether it's the standard definition or not, there's again a big spectrum of what that means and the continuity of having the same vet and the like experience of this. You've seen this dog every time and it's never been one that has like come up to hang out with you. Like I just had in this 14-year-old Bichon that I was like, this dog is mentally not appropriate, right? Like something, but that's only because I've seen it for so many years
Mm,
and it's never treated me like that. It's like always been a nervous little Bichon. And the whole point being, all of us in the home are doing a holistic experience in some way that I think a lot of us went into it for that holistic approach, whether it's by the standard definition or not. There's a component of this whole body and this whole experience around us. How are you interacting with your environment and with me? And how can I improve it? And so we're all on some sort of same,
Yeah.
mountaintop here or
I'm
mountain.
right there with you.
I don't know
I,
what the
I
phrase is.
absolutely believe that even if you're not like giving ozone or you're
Yeah.
not doing mistletoe injections or whatever, homeopathy, whatever it is, as a house call vet, you are inherently operating in a holistic paradigm. And that's what I think is so
Mm.
beautiful about house call practice for all the reasons that you said. But anyway, we got to end here so that there's some stuff we can save for the conference. Please, everyone, join us February 7th and 8th. It's going to be virtual. You can watch pre-recorded. If you can't make it in real time, you can watch afterwards. But the real time is really, really fun. Also, Cozy Cat is sponsoring the conference, which I'm so grateful for your support and your support all this time for every year of the conference thus far. Very, very meaningful, and it's an honor to have your support. So I hope everyone will join us. Tune in for Surell's amazing lecture on urinary management of house call scenarios, etc., etc. And we'll see you there.
Awesome. Will do. Thanks, Eve. Appreciate it.
Thank you so much for listening to this episode of the House Call Vet Cafe. If you enjoyed this episode, then hit the subscribe or follow button on Apple Podcasts, Spotify, Google Podcasts, YouTube, or wherever you listen to podcasts so you never have to miss an episode. This podcast is made specifically for you, so don't be shy if you'd like to reach out and let me know your thoughts on this episode. You can find me on Instagram and Facebook as the House Call Vet Academy, where I also share more valuable content. If you're interested in learning more about consulting for house call vets or the House Call Vet Academy online course and community, please click on the link in the show notes. Have an amazing rest of your day, and I can't wait for you to join us for our next episode of the House Call Vet Cafe.